Hey everybody, this is Dr. Jacobs. We're now moving on to our adolescence unit. So let's go ahead and get started. This unit, I would like you to learn some specific things while we move through the content. I'd like you to be able to explain the physiological and emotional changes that occur during puberty. I'd like you to be able to distinguish between primary and secondary sexual characteristics. I'd like you to be able to distinguish among the different types of eating disorders presented in this unit. I'd like you to be able to distinguish formal operational thinking from other stages of cognitive development. And then I would like you also to be able to explain what is meant by the phrase storm and stress. I'd like you to be able to also synthesize developmental theory to explain how moral reasoning develops across the lifespan. I'd like you to be able to define adolescent egocentrism, list the specific types of adolescent egocentrism, and provide accurate examples of each. I'd like you to be able to explain how adolescent egocentrism is different from childhood egocentrism. And then I'd like you to be able to distinguish between adolescence, limited turmoil, and life course difficulties. I'd like you to be able to produce examples of identity statuses and explain how to identify a particular identity status. I'd like you to be able to explain how identity versus role confusion relates to identity statuses. I'd like you to be able to describe self-concept and self-esteem. All right, so let's go ahead and get started into the content. Adolescence ranges from the start of puberty up until the legal age of adulthood. So this typically, if people are going to give a range to it, they'll say somewhere between 12 and 18 or 13 and 18. And it's more based into the actual characteristics of the stage. So it's usually puberty up to legal age of adulthood. And there's different phases of puberty. There's andronarchy, and this starts around ages between 6 and 8 years old. And this is when the adrenal glands start producing more types of hormones that will trigger some puberty type changes later on. This is more of an internal thing. This doesn't come with the physical changes that we typically identify being along with puberty. But then we get into gonadarchy, and this is when increased hormones that regulate physical and sexual maturation occur. And so this is when we start seeing some of the changes in height and in development of the gonads, which are going to be your sex organs. So this could be the testes, this could be ovaries. And so in puberty, different cultures handle puberty differently. And so this is basically a ceremony that marks the transition into adulthood. So quinceañera, it could be the Sweet 16. It could be like if you've seen the show Bridgerton, when they have their debut into society, these are all puberty rites that mark the transition into adulthood. And what we've seen in society as a whole is that we've seen a decreasing age of puberty, and they call this the secular trend in puberty. And they have a bunch of different theories of why they think this occurs. One, they think that we have more access to food, in particular nutritious food and fatty foods. They also theorize that maybe because we're seeing increasing rates of childhood obesity, that might also contribute to earlier puberty. There's a theory that maybe hair products that we put into people's hair could contribute to that. And then also kind of the breaking up of the family and stressful home environments, potentially if you were going through an evolutionary psychologist type view, that is also a theory as well. Menarche is the first menstruation. This typically happens between ages 12 and 13. These are averages, so they're not right on the dot. We know that some people start earlier, some people start later. And then spermarchy is the first ejaculation of live sperm, which happens around ages 13 to 14 years old. So there's some physical changes. We have primary sex characteristics, we have secondary sex characteristics, and we have growth spurt. So these primary sex characteristics are the development of sex organs that are necessary for reproduction. So this could be lengthening of the penis. This could be the start of ovulation in the ovaries. Whereas secondary characteristics are these changes that occur that happen along with puberty that signify that it's happening, but are not necessary for reproduction. So this would be widening of the hips. This could be armpit hair, pubic hair. It could be deepening of the voice, things like that. But things that are not necessary for reproduction. And we also see people go through growth spurts during this time as well. Typically, people in women's bodies go through their growth spurt first. So that's when you see the awkwardness, or people think it's awkward, where you see all the girls taller than the boys at a certain age. And then boys go through puberty and often shoot up higher in height. And so before we see this happen, before puberty, we actually see that male and female bodies are very similar in composition of muscle and fat. And then they go through puberty and we see some significant changes in these bodies. And so puberty also really affects the circadian rhythm. So our circadian rhythm is our day-night sleep cycle that we have. And puberty, what it does is it pushes sleepiness a couple hours later for adolescents, and they call this phase delay. So they don't get tired till a little bit later. And this is because we see blood levels of melatonin, which is a natural hormone that happens in our bodies that help us want to go to sleep and fall asleep. We see that those levels of melatonin don't increase till a couple hours later than they used to, and then they don't decrease until a little bit later in the mornings. And so they refer to this being awake more in the eveningness, and this is very common with adolescents. And this is kind of problematic because teens should actually be getting a minimum of 9 hours of sleep a night. But the way that society, at least here in America, is set up for public schooling, typically teens have to be up super early, so maybe be on the bus by 6:45 if they ride the bus. And then some people have even morning practices and things like that. And the American Academy of Pediatrics actually suggests that we push school later for teens, but society is not built to do that. And so often we don't see that for our teenagers. So melatonin, our bodies produce melatonin naturally in response to darkness. And a lot of you probably actually take melatonin as a supplement. So I kind of want to talk about it a little bit because the type that you take, whether it's like a gummy form or some form of that, if you do, is actually a synthetic form of melatonin. And many people take it, but the safety of the synthetic melatonin has not been fully studied. And one reason for that actually is because it's considered a supplement in the United States, which means it's not regulated by the FDA. So in actual other countries, they require prescription for melatonin. And so then it's more regulated. And so this is problematic because in a study that they did, I think it was in 2017, I could be wrong, they found that 26% of melatonin supplements also contain serotonin, which can be really dangerous for people, even in low levels. And so a lot of times you'll see on melatonin bottles that people should not take it if they have depression because it's messing with neurotransmitters and things like that. Some other side effects include some really strange dreams or nightmares, could be more depressed mood. You can have even some more daytime grogginess, and especially in particular, people who are in late adulthood have a harder time processing it for some reason. So again, natural melatonin rises in teens later at night and drops off later in the morning. And so this probably is what contributes to having that phase delay in adolescence. And so there are ways that you can naturally raise your melatonin, and you're probably not going to like the things that I tell you about how to do it. So psychologists often, if they have a client that has insomnia, will provide some sleep hygiene type suggestions. So this includes not having a television or a tablet or a cell phone in your room, right? And so it would also be like, okay, let's dim the lights as it gets later in the day so that your body has time to make more melatonin, and so that you can fall asleep easier. This would also be getting off your cell phone at a certain time at night and not using it because that light, they're not exactly sure how much it influences our sleep cycles. So we should also talk about nutrition. Many adolescents actually don't consume enough nutrients, particularly fruits and vegetables, especially American culture, American diet tends to rely on foods that are not as nutrient dense for ourselves or in our bodies, particularly fruits and vegetables and fiber content and vitamins. And so they recommend that people have a minimum of 2 fruits every day and a minimum of, well, actually just 2 fruits in general. There's actually no benefit in the research of having more than the 2 fruits, and then a minimum of 3 vegetables. So you can have much more vegetables, which provide a lot of that fiber and nutrients that we need. Also, menstruation depletes iron. And so it's really important that that's in consideration in diets for people in women's bodies who menstruate. We also see that half of adult bone mass is acquired from ages 10 to 20. So it's really important to make sure to be getting adequate amounts of calcium and vitamin D. Yes, our bodies produce vitamin D naturally. Actually, our livers produce cholesterol, which help us produce vitamin D in our bodies. But particularly if you live in the United States and you live if you live north of where Atlanta, Georgia is, during certain parts of the year, you're not getting enough direct sunlight to where our bodies can produce the vitamin D. So that's something that's important to keep in consideration because our bodies need vitamin D in order to absorb the calcium. We also talk about body image a lot of times when we talk about adolescence. And this is the person's idea of how their body looks. And so sometimes people have a disorder called body dysmorphic disorder, BDD, where they have body dysmorphia, where when they look in the mirror, they actually see someone who's larger than what size they are. And this can contribute to a whole host of problems with body image or even eating disorders. And so there's 3 major eating disorders that we cover in this unit. The first one is anorexia nervosa. And this is voluntary starvation. And so there's a ton of negative health consequences that can come from anorexia nervosa. For example, dangerously low blood pressure, dangerously low pulse, not getting the nutrients, brittle bones, osteoporosis. So especially if people are in women's bodies and they voluntarily starve themselves enough that they stop menstruating, if they have a body that menstruates, that can be problematic because estrogen protects the bones in women's bodies, which is why after women go through menopause later in life, that if they are at more risk for osteoporosis than people in males' bodies are. This also has the highest mortality rate of any mental disorder, which I find really interesting. So the death rate is the highest for this out of anything else. Because it is a very, very dangerous disorder. We also have bulimia nervosa, and this is compulsive overeating and purging. And there's a lot of negative health consequences that go along with this too. For example, increased inflammation of the esophagus or burning holes through the esophagus. The enamel can come off of the teeth because of the stomach acid from the vomiting. And then people with bulimia nervosa typically don't actually lose weight during this process. And so that's something interesting about that disorder as well. And then we have the last one, which is our binge eating disorder or BED. This is relatively new in comparison to some of the other disorders. It's a more newly recognized eating disorder. And this is binge eating without purging. And it has negative health consequences similar to obesity, so high cholesterol, heart disease, high blood pressure, and things like that. So eating disorder treatment, many times group therapy can increase the undesired behaviors. So for example, with anorexia nervosa, sometimes you have to be very careful that with inpatient treatment for it and not having groups, because sometimes then clients will compete against each other to maintain control and lose weight even more, which is antithetical to getting treatment for it. A lot of times patients will go through, or clients will go through cognitive behavioral therapy, or CBT. And the premise of CBT is that we have these thoughts and these automatic thoughts, and not all of them are true. And so learning and recognizing when our thoughts aren't true, and doing behaviors and how our emotions are all interconnected. Also, it's very important that you don't re-up calories too quickly with people with anorexia, because that can cause them to go into cardiac arrest. And this has happened where somebody went into an ER for anorexia, and they just pumped them full of calories, and they went into cardiac arrest and they died. There's also cognition. In adolescence, we see increased cognitive abilities. We see increased selective and divided attention. So if you remember from the last unit, selective attention is being able to focus on relevant information and then discount irrelevant information. And then divided attention is being able to perform two tasks at the same time. We also have increased working memory and increased long-term memory, increased processing speed, increased strategies to organize information, and increased metacognitive strategies. We move into Piaget's last stage of cognitive development. There is another stage that we potentially might talk about later, but that was developed by neo-Piagetians and not actually Piaget himself. So in this stage, it introduces the ability to think abstractly and consider hypothetical situations. So adolescents are able to think about situations about what if this happened, or what if that happened, which is very different than the previous stages of cognitive development. And Piaget would say that they can operate on forms or representations. So you can have an idea of something and be able to think of it in that form and not actually have to have it in front of you physically. Also, not all 12-year-olds fall into this stage, and many college students don't. And so it's really important to remember that we determine these stages by the characteristics of the stages and not necessarily the stages themselves. We also have adolescent egocentrism, and this is very different from childhood egocentrism. And if we remember back to childhood egocentrism, that was a child's inability to understand that people had different thoughts and emotions than they did. And then in adolescence, this is the inability to distinguish between their perception of what others think about them and what people actually think about them in reality. And so we have different types of this, of adolescent egocentrism. We have the imaginary audience, which is where they believe that they're going to be the focus of attention at all times, like they're on display, like they're on stage. And I have some thoughts on this actually as an adult. Sometimes I'm not sure how much of a like fable or how a misnomer this actually is. Like, I'm not so far off from being a student where I was in high school and realized that, like, if I got a bad haircut, people are going to talk about it. If I came with a broken arm, people are going to talk about it. And so although I understand that teens are not always the focus of attention at all times, I think it also depends on the context and the environment that they are. And we also have the personal fable, and this is where adolescents believe that they're special and unique and will live some form of legendary life. And I'm sad that we call this a fable. At some point, we think our lives are special and unique and that we're going to do really awesome things. And we have all these dreams. And then what happens? What happens to them? And so I think sometimes life, we see failure and we don't want to keep going and trying for these dreams. And that's really, really sad. And some people are destined to live special and unique and legendary lives. So I think it's just interesting that we think of this of an adolescent egocentrism with our adult eyes. We also have the invincibility fable, and this is when teens believe that they're invincible to bad outcomes from risky behaviors. So sometimes we'll see teens do really risky things like unprotected sex or drive at 120 miles per hour on the highway, which is why we see a lot of fatal car crashes with teenagers. and very frequently we'll see them in the news. And so some cognitive psychologists would say there's a dual process model of cognition, and that humans have two distinct different networks for processing information. We have the intuitive thought, where it's this automatic, unconscious, and fast, more experiential based and emotional type thought. And then we have our analytical thought, which is deliberate, conscious, and rational or logical. So with this, teens, from research shows that they tend to rely more on intuitive thought in the beginning, but as they get a little bit older and more maturated, they tend to have more analytic thought, which is more deliberate and conscious and rational, which often comes from just life experience and also changes in cognitive development itself. We also have the behavioral decision-making theory, and this is where you weigh the potential rewards and consequences of an action, and everybody does this. But adolescents tend to favor rewards, especially social ones, in comparison to adults. And then adolescents also learn to think relativistically. And so because of this, they're more likely to question other people's assertions and less likely to accept information as absolute truth. They learn also that rules aren't absolute, and that there's some rules that we follow because it's common sense, like you don't want to cross the street without looking both ways because you could get hit by a car. And then there's other rules that are cultural in nature. For example, in America, we don't burp, where it's considered rude and it's a cultural rule, while in other countries, it's shown as a sign of respect to the chef that you burp. And those are cultural rules instead. Moral reasoning. So we did a big thing on moral reasoning in the last unit. In adolescence, we see it develop further. So as kids, typically we see that family, culture, and religion mostly influence moral decisions. But as adolescents, we see that peers increasingly become more influential in moral decisions and reasoning. And then by the time kids get to late adolescence, most are less rebellious and start to establish their own set of identity and beliefs and morals and values and make decisions based in those. So we see the construction of identity as a really major part of adolescence, and adolescents trying on different types of identity in different ways. Erik Erikson names the stage identity versus role confusion. So this is part of psychosocial. If you remember, our first stage of Erikson's theory was trust versus mistrust. Then we had autonomy versus shame and doubt. Then we had initiative versus guilt. We had industry versus inferiority, and now we have identity versus role confusion. And so the challenge in identity versus role confusion is to either figure out who you're going to be or be confused about it and struggle with it. And so there's another theory that goes along very well with Erikson's theory, but it's the identity status theory that we're going to learn about. So identity statuses, there's 4 different ones that we'll learn about, but there's 2 constructs that we examine to determine what your identity status is. The first is crisis. So crisis means a different thing for this theory than it does for Erikson's theory. So in Erikson's theory, crisis just means a challenge. In identity status theory, crisis means exploration. And then the other construct that determines your identity status is commitment. Okay, so originally this theory dealt with like career, political, and religious identities, although there's a ton of different identities that could probably fall within this. So ethnic identity, gender identity, sexual orientation identity, and just different elements that are an important part of who you are as a human. And so here they are. So we have 4 different identity statuses. Our first one is identity diffusion. In this situation, a person has not explored their options for their identity, and they're not committed to any particular identity either. So if we're talking about with this related to career, they haven't searched for what they want to do, and they're not committed to anything. They're kind of just floating around. And some of you might be in that spot for your major, and that can be very, very stressful to not really want to explore, but not really know what you want to do either. Identity foreclosure then is they have not had that exploration for themselves, but they are committed to something. So for example, if your family owns a business and you've not explored anything else and you're committed to taking over the family business because that's what your parents want for you, then you are in identity foreclosure. So then the third identity status is moratorium. This is where you're currently exploring your options, but you're not really committed to anything yet. And society uses college a lot of times as a place for people to be able to explore their different career options or religious options or political options. And so if you're currently exploring, but you're not really committed to anything, you'd be in moratorium. And then we have identity achievement, which Marcia would say is the best of the 4 identity statuses. And this is where you've explored your options and you're committed to your option. So now that we've gone through these 4 different identity statuses, I want you to think about personally in your own life, what identity status are you for your future career? So think about, have you explored your options? Or are you currently exploring your options? Or have you not explored them? And then how committed are you to these things? Are you committed? Or are you kind of committed? Or are you fully committed to the path that you're choosing? Because you're actually the person choosing your own life. And in the past, I've talked to students about this, and sometimes students will change their major after learning about identity or taking this class, because ultimately no one can choose your path for you. You get to choose it. And so hopefully it's something that you've explored, and explored in different ways, whether it's looking at motivation or interest or finances, so you can live the kind of lifestyle. Only you can decide what you're wanting to do with your life. And we also have self-concept. And this is when teens start to define themselves by thoughts, values, and opinions rather than physical attributes. And so, because actually when we're tiny, we actually define ourselves by physical attributes. I'm tall, I'm a boy, I'm a girl, things like this. And so when we're thinking about self-concept, there's different parts. Our actual self is the person that you are. Our ideal self is the person that you want to be. And the feared self is the person you don't want to be. And if you look at all these things, hopefully, whoever your ideal self is, you're moving toward that person, right? And we have a feared self, the person that we don't want to be, typically coming from different experiences. So if you had a parent or a caregiver that had an alcohol use disorder or a drug use disorder, and that really impacted you, that's probably not who you want to be when you grow up. And that might be the person you fear that you'll become. We also have self-esteem, and this is one's thoughts and feelings about one's self-concept and identity. No research supports that this drops in adolescence, even though that's kind of a common misnomer that self-esteem is lower during adolescence. And then we move on to storm and stress. This was a really famous quote by G. Stanley Hall, who basically used it to kind of describe the intense moodiness, emotional sensitivity, and risk-taking tendencies of adolescence. And he used these to characterize the life stage he labeled adolescence. The research is actually kind of mixed on this now. Most teens don't actually have major conflicts with their caregivers. If they do, they're usually pretty minor ones. And many times these happen when the teen's autonomy conflicts with the supervision and control that the caregiver wants to have. Because during this phase of life, there's a renegotiation of the roles that people are having, or that parents have or caregivers have in a teenager's life, and who the teenager is going to become. Friendships during this time typically move further away from same-sex friendships to more mixed-sex friendships. A lot of times adolescents will choose friends similar to them in some way, and they call this homophily. And a lot of times romantic relationships come from these mixed group friendships. And so most romantic relationships in this stage aren't long-term. They can be, but most of them are not. But a lot of emotional and resources and energy are tied up into these, and they influence teenagers quite a bit. During adolescence, it is actually kind of normal sometimes to see some antisocial behavior. Behaviors that are antisocial that stay only within adolescence and resolve them are often called adolescence limited turmoil. However, if adolescents don't grow out of it, we call those life course difficulties, and that's going to cause problems in people's lives. So that's what we have for adolescence. I hope you enjoyed the lecture, and make sure that you go back and look at the unit learning objectives and that you can do each of those things by the end of this unit. Have a great week.